Today we are going to discuss, why do health insurers require prior authorization? Insurance companies and health plans use prior authorization to make sure that a specific medical service is necessary and being provided cost-effectively. Your health plan uses prior authorization as a way to keep healthcare costs in check. Ideally, the process should help prevent too much spending on unnecessary medical care. A pre-authorization requirement is a way of rationing health care. Your health plan is rationing paid access to expensive drugs and services, making sure the only people who get these drugs or services are the people for whom the drug or service is appropriate. The idea is to ensure that healthcare is cost-effective, safe, necessary, and appropriate for each patient. In the process of prior authorization, your insurer will make sure that certain criteria are met. Like medical necessity. Being medically necessary means that you really do need the service or drug your provider is prescribing. When insurers are trying to determine if criteria for medical necessity are being met, they're looking for factors like whether the treatment is recommended for your situation according to up-to-date, research-backed evidence. They're also checking to make sure that the service is not being duplicated. For example, if you have lung cancer, you might be seeing more than one specialist. Your lung provider might order a chest CT scan, not realizing that your cancer provider had you get one 2 weeks ago. In this case, your insurer would not pre-authorize the second CT scan until it has confirmed that your lung health provider saw the scan you had 2 weeks ago and still thinks you need to have another one. Next criteria would be cost. Insurers also want to see if it makes financial sense for you to have a service or treatment. The procedure or drug should be the most economical treatment option for your condition. For example, imagine that drug C and drug E both treat your condition. Drug C is cheaper and drug E is more expensive. If your healthcare provider prescribes drug E, your health insurance plan may want to know why drug C would not work just as well. If your provider can show that drug E is a better option for you, even though it costs more, it might get pre-authorized. However, if there's no medical reason why, the more expensive drug E should be chosen over the cheaper drug C, your health plan may refuse to authorize it. And the other criteria would be benefits. Your insurance provider needs to make sure that ongoing or recurrent service is actually helping you. For example, suppose you've been having physical therapy for 3 months and your provider is requesting authorization for another 3 months. In that case, your insurance plan might wonder if the physical therapy is actually helping you. The additional 3 months might be pre-authorized if you're making slow but measurable progress. However, if you're not making any progress or the physical therapy is making you feel worse, your health plan might not agree to authorize any more physical therapy sessions until it talks with your healthcare provider to better understand why they think another 3 months of physical therapy will help you. What medications and services require prior authorization? Prior authorization is generally not required or allowed for emergency services, as there wouldn't have time to request and receive it. Retro authorization is occasionally used after the fact in emergency situations, although this is rare. But for certain types of non-emergency care, your insurance plan wants to make sure that the care is necessary and the most cost-efficient option. Medications that require prior authorization. Drugs with serious risks. Expensive drugs, especially if there is a lower-cost drug available to treat the condition you have. Drugs that carry a high risk for misuse or addiction. Drugs that are used for both cosmetic reasons and to treat medical conditions. Services that require prior authorization. Some services, tests, or procedures are more likely than others to need prior authorization.
Examples of services that commonly require prior authorization before being approved include diagnostic imaging, such as MRIs, CTs, and PET scans. Durable medical equipment, such as wheelchairs. Rehabilitation, like physical or occupational therapy. Home health services, such as nurses. Non-emergency surgery, elective surgery. Does Medicare require prior authorization? Original Medicare, Medicare Part A and Part B, generally does not require prior authorization. Medicare Advantage plans often do require prior authorization. However, the federal government finalized new rules in 2023 to streamline Medicare Advantage's prior authorization processes and minimize how much prior authorization requirements prevent enrollees from receiving timely medical care. I'd be so grateful if you subscribed. Your support helps me keep creating content for you.